I think urology centers is a very unique urology practice in that we have very positive people that are here for patients. We treat all aspects of urological care from diagnosis all the way to treatment to follow-up. And additionally, we really try to employ new and innovative techniques to treat the urological disease process. I started my residency at the LSU Ochsner program down in New Orleans in 2002, and within a few years of me being in that program, Ochsner set up a robotics urology program, and so I was lucky enough to be one of the first urologists in training down at that program that from day one of the urology program began having time and experience with the robot and the different surgeries that you can perform with it. So I had extensive training in robotic surgery for my entire residency, which was lucky because it is such a new technology. I was lucky enough to interview with Urology Centers of Alabama, which had the most extensive and a long experience with the robot. They were one of the first places to really use the technology to its fullest. And after visiting with them and seeing the program they had in place and meeting with some of the other doctors that have been here, I was really encouraged with what they had, and was really lucky enough to get an opportunity to come work here and join the robotics team, and start doing some of the surgeries, start doing even some more surgeries that weren't being done here before. With the Ada Robotics, I treat really all areas or all fields that are covered in urology. I treat the kidney with the robotic surgery. I do prostate surgeries both for benign and cancerous disease, and also perform bladder cancer surgeries with the robot as well. The most rewarding part of being in urology is the benefit that patients get from the care that we give to them, and seeing how their lives have been impacted by the surgeries and the treatments that we give to them. I mean, when you see patients that are either suffering or very worried about their disease and their potential cancers they may have, and then when you treat them and see the positive impact you can have on people and how you can really give them a better quality of life and really help them or their family members out, it's really very rewarding. When I was in residency down in LSU, my wife is from Birmingham, and I went to undergrad and med school here, and I'm from Dothan, Alabama, and so we both knew we wanted to come back to Alabama. When I'm not at work, I have two small boys that are 2.5 and 1.5, and so I spend the majority of my time with them outside of work. But besides that, I do a pretty good bit of running, get out and exercise, try to get some time outside. One of my biggest stress relief is one that I learned from my dad. Ever since I was a kid, he was really big into stereos and record players and listening to music, and that's kind of definitely rubbed off on me. And over the past few years, I've been lucky enough now that I spend a lot of time buying and repairing old stereos and record players and giving them to friends as gift, and giving them to my dad as a gift since he taught me all that. But it's something that I really enjoy and gives me a good stress relief when I'm at home. I really went into urology because I enjoy all aspects of urology, but one of the things I try to bring to my practice is, while treating all aspects of urology, to try to figure out a minimally invasive way to treat the disease process. Whether it's with laparoscopy or robotics, I really try to focus on finding a minimally invasive way to do that.